So, good day. I am Angelica Dimaano from 1BSN3, a nursing student from PLMAR, and I'm going to perform an assessment of the eyes, ears, nose, mouth, and throat. So, first, I will going to perform a hand hygiene and wear gloves to prevent the spread of infection and microorganisms. So, good morning, Ma'am Jasmine Sandalo.
Good morning.
My name is Angelica and I'm going to be your student nurse for today. For your eyes, ears, nose, mouth, and throat assessment. Okay. I will just close the door for them and to provide privacy. Okay, Ma'am Jas, can you please sit here to provide, make you comfortable? So the equipments that we'll be needing, so the equipments or the tools that we'll be needing are gloves, pen light, glass of water, Snell and eye chart, cotton swab applicator, tuning fork, and tongue depressor. So hello Ma'am Jazz, as soon as I put on these gloves, we're going to start with your eyes. So first, check for the visual acuity of the client by using a Snell and eye chart. So first, ensure a good natural light of the chart. Ask the client to read the letter to which I am pointing. So, ma'am. Ma'am. I want you to read the letter that I am pointing and cover your right eye with your right hand and do it also on the other side. Okay. So, can you read this?
P.
This,
C.
this,
E.
this,
E.
and this,
B. E. F. F. P. O. P. E. C.
Okay, great. So, the other side. Can you read this?
F. Z. Z. E. P. O. E.
Okay, so good. So, next in the external eye structure, I'm going to... So, ma'am, with your head up, looking straight ahead, I need you to follow my finger and I will move it in several directions. And I need you to follow it with your eyes only without moving your head. Okay, so is it clear to you, ma'am?
Yes.
With your eyes only, okay? Can you follow this finger? Okay. Next. Okay, good. So, next is we're going to proceed in your ears. So, first in the external ear, inspect size, color, auricle, tragus, lobule, ear canal. So, next I'm going to palpate your ears for any tenderness, pain, any masses, Ma'am, I'm going to touch your face. Okay. Do you feel any pain as I touch your ear?
Not at all.
Okay, great. So, no signs of swelling as I touch it? Okay. Okay, great. So, the mastoid process, do you feel any pain or any tenderness?
No.
So, there are no swelling or any masses?
No.
So, the cartilage and mastoid process is normal. So, next we're going to proceed to the ear canal and the tympanic membrane. Okay. So, I'm gonna touch your ear. Do you feel any pain as I'm pulling on your ear?
No.
No. So the patient's ear canal is the same with the color of the ear, no presence of foreign bodies, and also on the next other side, it is the same as the color of the ear and no presence of foreign bodies. Next is we're going to proceed in the hearing and equilibrium test. So I am going to stand behind and place a hand in one ear and into the eye. Can you move your chair more? And I will whisper any number and I'd like you to repeat those numbers to me. Will that be okay?
Yes. 24. 32. 69.
Okay.
34. 36. 21.
Okay. So, now for the next part, I will be using a tuning fork. Applying the Weber's and Rhine's test. To activate the tuning fork, we need to ping it or we could tap it on our knee. I will do a Rhine's test first and I will put the tuning fork in the mastoid process. So, ma'am, where did you hear the sound better?
Ear.
Here, okay. Since the patient hear the sound on her ear, it means that the air conduction is greater than bone conduction and it is normal. Now I will perform Weber's test. Again, I will place the tuning fork on the center of your forehead. Let me know where you hear the sound.
Midline.
Okay. As resulted in Rhine's and Weber, the patient hearing are normal. In an abnormal Weber's test, the sound of ears is louder in the deaf ear. So this will result for sensory neural deafness. While in Rhine's test, if the bone conduction is better than air conduction, the hearing of the patient is normal or has a conductive deafness. Next, we will proceed in assessment the nose and the sinuses. First, you need to inquire the client's history of allergies, difficulty of breathing, sinus infection, nosebleed, changes of smell. Do you have any allergies?
In nose? No.
So now, ma'am, we're going to include one side of your nostril. Can you occlude it for me like this? So, ma'am, can you occlude it for me like this? So, can you inhale?
Yes.
Exhale. On the other side, inhale. Exhale. So, did you have a hard time breathing?
No.
On the other side,
No.
okay. So the patient can breathe normally even if one side is occluded, so there is no obstruction at all. So next is inspect and palpate the nose. So the color of the nose of the client is the same as her skin. The shape is normal. Both nostrils are normal. The septum is also normal. Sinus infections. No signs of any swelling or inflamed part of the nasal cavities. Nosebleeds. No pressure of nose bleeding. Or any changes, do you feel any changes of your smell?
No.
No. Okay, good. So, next we're going to palpate your nose. So,